Hello everyone, this is your host. Welcomes you all in the Therapist Talk Show with me, Physio Anjali. Before starting the episode, sending you all warm wishes, love, luck. May God help us and hear us. Today's episode is really special as we have the guest of our show is Dr. Samana Sayed Mam. She is renowned physio from Mumbai, India, international speaker, writer, resource person, and have conducted multiple lectures and workshops globally. She is also international certified cardiovascular pulmonary rehabilitation therapist, antenatal postnatal therapist, ergonomist, and fitness advisor. Currently, she is a HOD and senior consultant in the clinic and Krishnaya Hospital, Mumbai, India. Ma'am has done various multiple television shows with international TV channels. Ma'am has been invited by IB in Africa as a Indian physiotherapist, health columnist in newspapers like Voice of Malabar Hills, and also have published article in DNA, Times of India, Mumbai. Various articles to spread awareness about chest PT and other health related topics, and recently published article in Physio Times magazine July 2020 issue on COVID-19 role of physio in it. Conducted more than 20 e-workshops and taught approx 500 to 1000 students about COVID-19 and PT in it post lockdown. So thank you, ma'am, for joining in my show and accepting the invitation. It's my honor to have you on my show. Thank you so much.
Thank you, Anjali, for inviting me for this show, and thank you for the wonderful introduction that you have given. I don't think so there is anything else I would like to speak about myself. So I'm all set to answer your questions and we can go ahead with it then.
Thank you, ma'am. Thank you so much. I would like to start with your experience in cardiopulmonary field before COVID and after COVID, as COVID has increased the importance of cardiopulmonary rehabilitation among physiotherapists and also students also. So how do you feel on that, ma'am?
I have been practicing chest physiotherapy for over a decade now, and yes, I would say over the period, I could say that over the years, I have seen that this field has flourished, and with the recent researches, the updating of the researches, you could say, there have been a lot of things, you could say actually new things that are included in this field. And I love being a cardiopulmonary physiotherapist, definitely. I love treating patients for chest physio, and I have been working on the awareness of this field for years, not only for physios but also for the general population, because if you will talk about a decade before, or you could say just 5 years or 6 years before, still there were a lot of myths about chest physiotherapy, and very limited people were aware of this field as a part of physiotherapy. In fact, I always used to get questions also initially that okay, तो आप chest और heart के साथ करते क्या हो? Like what you are doing with lung and heart? Are you giving any exercise or are you giving any machines over that? So like the basic concept of being a physiotherapist was always something that is dealt with neuro or sports or musculoskeletal. So making people aware who are not a health care professionals, of course, about the chest physiotherapist part was like really tough initially, but over the period of time people started being more aware of it. And yes, I would say there have been a tremendous change in the perspective of people, and chest physiotherapy has really been on limelight since this pandemic has hit, because this COVID-19 condition primarily affects your respiratory system, and that calls for the important role of chest physiotherapist. And definitely cardiorespiratory physiotherapist or cardiopulmonary, or you say chest physiotherapist, plays an important and an integral role in the treatment of COVID-19 condition, from the time the patient is admitted in the ICU, or let the patient be in isolation or quarantine, or if the patient is recovered, or for a long-term rehabilitation period, everything. So definitely a lot of things have changed in terms of chest physiotherapy, and people are becoming more and more aware of lung physio or specifically respiratory physio. So I am a hardcore pulmonary rehabilitation therapist. Definitely I do see the cardiac part of it as well, but I have been working as a pulmonary rehabilitation therapist for years, and this disease has highlighted the importance of pulmonary rehabilitation to be specific when it comes to physiotherapy. So definitely there have been a lot of changes, but my experience as a chest physiotherapy over the years, since I'm a hardcore clinician, or you could say a person who has always been working in clinical or hospital settings, so for me, delivering or educating people with the practical knowledge that I have done, like that I have explored over the years, was something really fruitful. And I'm really happy that I could do that, not just amongst the healthcare professionals but also amongst the commoners. So I guess now this pandemic has really helped us as a chest physiotherapist to actually increase the awareness of this field, and definitely we are looking for a long-term thing. So yes, for all the physiotherapists, if you're looking for any field, then chest physio is really a good option in this era.
Yes, ma'am, I totally agree with you that chest physiotherapy is the most important thing in this era. So, and I think people will more fall into the love of chest physical therapy, cardiopulmonary therapist. So, ma'am, moving forward, if you want to give a quick suggestions to the therapist who are treating COVID-19 patients, so what are your quick suggestions to them?
So, as I said, that definitely COVID-19 is a disease where the role of physiotherapist is important. The quick suggestions, if you'll ask me about giving to the physiotherapists who are treating COVID-19 patient, is first, you have to first look for your safety. Your safety is really important, and this is something that you're not being selfish, but definitely if you are not getting affected, then definitely you cannot even lead to the spread of it. It's as simple as that. Our own security in this case, or preventing yourself from getting COVID-19 in this era, is not termed as something selfish, because one, we have to break the chain, and that can only happen when we prevent the spread of this disease. So first thing, that the quickest suggestion I could say is actually wearing a proper PPE. So PPE or protective equipment is really important when it comes to treating any kind of COVID-19 patient for any healthcare professional. So first thing is about your safety. You have to be very smart. And when it comes to the condition, then as I said, that it affects mainly or primarily the respiratory system. So for any physiotherapist, it is very important to know what all conditions or what all breathing exercises are required for every patient in different stages of disease. So summarizing it, I would say that a good proper deep breathing exercises with a good set of exercises for improving the strength and endurance of the patient is really important. But you have to be very logical as a physiotherapist, very calculative, because the best part of this disease, or you could say the worst part of this disease, is the virus is very tricky, and it shows a lot of different symptoms in different individuals, region, as per the demographic of the country, you could say. So you have to be smart enough while deciding your protocol as per the underlying condition of the patient, or as per the disease severity at which the patient is coming to you for the treatment. So we have to be very calculative whenever we are treating, and very logical whenever we are deciding the protocol for any kind of chest physiotherapy, for any kind of COVID-19 condition. And other than that, the last thing is, the quickest reply is that if you think that you will be spared from treating any kind of COVID-19 patient, then you are wrong. Either now or in near future, or you could say ahead, after the patient is recovered and coming to you for rehabilitation, you will be encountering these cases with the rate of the speed, or you could say with the speed this virus is increasing. We really need to be aware of this condition and how to treat this condition from a physiotherapist perspective. And I think a good cardiopulmonary physiotherapist can really guide you well with this, because we are actually seeing such conditions for ages. Like pulmonary rehabilitation has been an important part of my life, and of course many other physios are doing that. So yes, you need to really know the pathology and the treatment protocols that should be used in this. So that's why you have to be calculative as per the stages of the disease.
Thank you, ma'am. Thank you for your quick suggestions and quick tips. I hope that the therapist can get learned through this also, and mark this also in their list. If I'm talking about symptoms of COVID-19, so how there is a prominent symptom, that shortness of breath. So how do we treat it?
So talking about shortness of breath, Well, shortness of breath is not the main symptom that happens initially, but yes, as your disease progresses, the one of the symptom is shortness of breath. Otherwise, fever, fatigue, dry cough is usually the main primary symptoms of this disease, and definitely with the progression, the person can get shortness of breath as well. So the first thing as a physiotherapist, you should know that if you are dealing or seeing any kind of patient with COVID-19, then you should have a handy pulse oximeter with you, or your patient should be having it, because whenever you are giving any kind of exercise, you have to keep a track on oxygenation of the patient. If the patient's condition is deteriorating and the disease is progressing, then shortness of breath can occur, and the instant thing that you can do is definitely first call for a medical emergency, because the patient may need an oxygen support. Keep a track on the patient's SpO2 and try to give different relaxation positions, different relaxed breathing positions to patient, different relaxation breathing techniques to the patient, to try to normalize the breathing of the patient. And all this can be done by reducing or giving the positions in which you can reduce the work of breathing of the patient as well. So a relaxed positioning is usually advisable in this condition.
Okay, ma'am. Positioning can help us to relieve from shortness of breath instantly if a person is having the shortness of breath. So, ma'am, if talking about more about positioning, what does prone position plays a role in it, and how does it plays a role? If you can explain us or brief us about that.
So talking about prone positioning, this is something which was practiced for years in cases of respiratory failure or ARDS conditions. So I won't say this is something new to be practiced for respiratory failure, but yes, in COVID-19 conditions, it has been used tremendously in various other countries as well. For the patients who are getting ventilated due to respiratory failure, or for the patients where the lung is affected, basically and primarily to maintain the ventilation, because when we talk about this disease, it basically affects your lower lobes of the lungs, and that can lead to pneumonia, and as the disease progresses ahead can lead to ARDS or acute respiratory distress syndrome or respiratory failure. So usually, as per the researchers, prone positioning is advisable for hours. In many researches, it is advisable for 12 hours also approximately, and it again depends on the individual condition of to decide whether you can give this to a person or not. So yes, it does help in improving the ventilation, managing or maintaining the ventilation perfusion ratio as well. But it is very important for you to understand the contraindications and indications of putting the patient in a prone position, and managing the vitals, like keeping a proper track of the vitals of the patient. And only when the patient is able to do that, then only you can give this to a patient. But yes, prone positioning has been proven to be very effective in kind of COVID-19 conditions.
So I hope people have get clear instructions about prone positioning, and yes, it has been proven effective in COVID-19. And if talking about the importance of breathing exercises, it says that it plays a role in pulmonary diseases. So how do you think that people should add breathing exercises in their daily routine, and what are the benefits from it?
So as I said that doing a deep breathing exercise or a breathing exercise in COVID-19 is really helpful, even for the patients who are into mild stage or asymptomatic stage. A good deep breathing exercises should be started, so that we can at least prevent the progression of the disease, or even if the progression is occurring or the progression is happening, then we can actually expect a good early recovery of those patients. Now when we talk about doing this in healthy individuals, yes, I would highly recommend to these to people. I would highly recommend deep breathing exercises, because when you do a regular breathing exercises, it improves the oxygenation in your body. It helps in removing the toxins from your body, and which ultimately improves the immunity. And immunity is one of the main thing that we all are focusing now when it comes to preventing yourself or helping yourself to recover early from any kind of COVID-19 infection. So definitely adding breathing exercise to all the other things that you are doing for improving your immunity is really important. So to summarize it, I will say that a good sleep, good nutrition, regular physical exercise for 30 minutes minimum in a day, and breathing exercises can really help you in improving your immunity and fighting this virus, even if you get affected with this virus, especially if you stay in an area or if you are a person who is at high risk, like if you're having diabetes, hypertension, old age. So these kind of people are usually someone whom I would say that should definitely add breathing exercise in their regular routine, because it has got amazing benefits and definitely it will improve your overall aerobic capacity and cardiorespiratory fitness.
So all the people listening out there, breathing exercise is highly recommended by ma'am, and we would suggest that do that in your daily life, as it will improve your immunity also, and it will help us to fight through these viruses. Ma'am, if talking about ICU posting of students, so how do they manage patients there? What are the basic requirements, or what are the basic tips for them from your side?
Or all the physiotherapists who are actually seeing ICU patient is that you have to remove your ICU phobia. There is nothing to be ICU phobic, especially when it comes to COVID-19 condition. Treat it similarly as how you have been treating other ICU patients. And in fact, due to the increased rate of the disease and the increased number of individuals getting affected, a lot of physios who were actually not seeing ICU before are also being asked to start seeing patients in ICU and hospital wards for COVID-19. So it is very important for you all firstly to know the basics of this disease, the treatment protocols, pathology and everything. And secondly, treat it like any other condition, like any other lung condition when it comes to ICU specifically, because patients who are whose lungs are basically affected are getting ventilated and are getting admitted in the ICU. So yes, you can treat them as any other normal condition without being phobic about this. The main thing that you have to focus on is firstly a proper protective equipment, a proper PPE. You should know how to wear it, remove it. Safety, hygiene are the two important things when you are seeing this patients. And secondly, you could say the most important thing being in ICU is you should know your role as a physiotherapist. It is not necessary that you will be required for all type of patients in the ICU with COVID conditions. Now, when this disease actually occurred, WHO or World Health Organization has given their guidelines, which actually included that to minimize the staff in the ICU. So minimizing the staff included only keeping those staffs who are required when it comes to the treatment of the patient. So when it comes to the ICU part, basically this disease does not leads to a lot of secretions or mucus production. So only if it's required, or if the patient is having it because of any other underlying condition, then only chest physiotherapy is advisable. Otherwise, in ICU, the primary treatment includes positioning, proper positioning as per the condition, and early mobilization. Like early mobilization is even given to patients with ventilator, and it has been really proved effective and helpful for patients who are ventilated and having active cases. So yes, early mobilization is a key for recovery in these cases as per the researchers and evidences from various countries who are badly hit by this virus. And other than that, if whatever else is required by the patient as per their underlying condition, as I said that every individual shows a different characteristics, the physiotherapist has to plan the protocol accordingly and see whatever is required without increasing the work of breathing. So that should be your main criteria whenever you are seeing any kind of patient in the ICU, that not to give any maneuver that will increase the work of breathing of the patient, and to give all the maneuvers that will reduce the work of breathing. So these two things are very important for physiotherapists to understand, and nothing to worry, nothing to get scared of. Treat it like as any condition that you see in ICU with proper ethical guidelines.
So all the students, don't be ICU phobic. Guidelines, follow the guidelines given by WHO, follow the guidelines given by the staff where you have posted. Don't worry, stay fit, stay safe in that environment, and know that when you have to be there and when you have not to be there. Follow guidelines, know about mobilization, how we can do, practice that. That's it. Thank you, ma'am, for the advice, and I hope people will follow this and have been learned so much from it. Ma'am, at last, if talking about any positive affirmations you want to give to our listeners from your side.
So firstly, the most positive thing that you want me to tell the listeners is don't be positive. That means don't be COVID positive. Try to be very much smart, alert, maintain social distancing, maintain proper hygiene. Even if you're seeing any COVID patient, you have to take care of your safety and your security primarily. So it is very important to be COVID negative in this era. And other than that, definitely we need to understand that this disease is not going soon, and we don't know when the vaccines will be made and by what time will it reach us or reach the individuals. So we have to live with this era, and the only thing we can do this is by being positive and keeping ourselves mentally prepared that we have to deal with this era, which I usually call as COVID era. So usually in all my workshops, I always tell all the physios and professionals who are attending that we have to live with this era because a lot of things have changed. Our practice, everything, like our professional practice has been affected. It has changed and it will keep on changing further ahead. So all we could do is we can just be for each other. We all are together in this, and we all have to cooperate and support each other in all the possible ways. So we all have to really be very much mentally prepared to deal with this pandemic. And as I said that we have to be smart enough while seeing the patient. We need to really now decide and divide our criteria of seeing general patients other than physiotherapist also. But there is no reason to be panic about this thing. There is no reason to stress about this because, as I said, we have to live with it. So the best way to actually utilize our energy is not being negative about it, but finding out ways of how we can actually cope up with this and manage with this. We all can actually together help each other and really work together to support, or you could say we can support each other to really deal with this condition. And it is not a one-man thing to actually do that. So yes, be positive, spread awareness. Don't be scared of seeing any COVID-19 patient, because if you are just following a proper guidelines, you can definitely treat these patients on regular basis. A lot of physios are doing, we have been doing it, and I have been training a lot of physios over from the time this pandemic has started, and most of my physios who got trained under me are frontline warriors. So yes, we need to understand and we should be proud of the fact that we have got an opportunity to be a frontline warrior in a situation where we can actually give our best. So that's all I would like to tell you, that be positive and spread positivity, but don't be COVID positive. That's it. So I hope it's clear, and it was lovely interacting with you, and I hope I'm clear with my questions. And all the best. Be safe to all of you. Follow the government guidelines properly, maintain social distancing, and spread awareness and make others also follow the proper guidelines, so that we can actually break the chain and we can break the transmission. We can stop the transmission of this disease. Thank you.
Absolutely right, ma'am. We don't have to be COVID positive. We have to be COVID negative, but in life positive, to spread positivity and spread awareness regarding this disease. Thank you, ma'am, for your time and for your words, for your advices. It's my pleasure to have you on my show. Thank you for being there. And to all the students out there, here are my 5 quick tips which I have recently learned from ma'am's workshop and talking in this video from ma'am's and having this show for all of you guys. First is learn about breathing exercises. Second, learn about chest mobilization exercises. Third, learn how to treat patient, how to deal with their psychological issues. Fourth is be positive. Firstly, care of your safety. Know how to remove PP, how to wear PP kits out there, and much more you can also learn from ma'am's, because ma'am is doing workshop recently and continuously. So do join ma'am workshop, COVID workshop. You will gain a lot more information which I have gained, because I can't express or I can't tell all of these together in this here. So thank you for joining in. Thank you so much, ma'am, for your time, and I hope this show has been very helpful and knowledge gaining to all of you guys. Thank you so much. See you soon in the next episode. Bye.